Testing. Adena. My name is Dr. Kataka, and we welcome you and hope that you find this production today very valuable. You know, in the earlier part of this year, because of COVID restrictions and shutdowns, we had to eliminate, push back, or delay much needed screenings. It's October, so it's Breast Awareness Month. All of us are wearing here pink here in honor of that month. And we want to be able to update you and provide you valuable information that will help you. Unfortunately, more than 250,000 of individuals will be diagnosed with breast cancer in 2020 alone. That's why it's so important to have breast screenings done. At Adena, we work to remind people of the importance of regular mammographies. Early detection, as you'll hear from our guest today, will help with successful treatment, remission, and even hopefully eradication of breast cancer. We're asking our patients, family, and friends to use the hashtag #SupportTheGals to help promote regular mammography screening. We encourage you to use hashtag #SupportTheGals in social media posts and texts to let your family and friends know that you care about them and that you're being proactive about breast cancer screening. As always, we want to hear your questions or comments, so please enter them in the box below. We have staff that are ready on standby to help us get us those questions so that we can answer them for you. I'm pleased to introduce our two guests today that are joining us. To my right is Dr. Shailaja Mani. She is a hematologist and oncologist with the Adena Cancer Center. And with her today is Kendra Pollard, who is the Breast Health and Imaging Navigator for Adena Health System. Welcome, and we're glad that you're here with us today.
Thank you for having me.
Thank you.
Yeah. Kendra, let's start with you. For those who are listening to us, can you share a little bit about who you are and your background?
Yes, I'm Kendra Pollard. My role here at Adena is I'm a breast health and imaging navigator. So I'm here to help patients with ensuring they do get their screening mammograms, and if there are any abnormalities, help to determine exactly what imaging is needed, get those the imaging that is recommended for them completed, and if a biopsy is recommended, help to get a final diagnosis so we can do a seamless process with our oncology department and surgical care here at Adena, or the patient's choice.
And Kendra, how long have you been with Adena?
Yeah, I've been here I'm going on 15 years now. I've been a mammographer initially when I was initially hired for about 5 years, and I'm now in my navigation role.
And which locations do you work out of?
I'm always here at Chillicothe at the main site. I'm here for patients to consult with them. If a biopsy is recommended, I'm right there with them initially at the very first communication from our radiologist when they find that there may be something there that is indicating for a biopsy. So I have an office here on site, but we have services that extend throughout all of our surrounding counties.
Well, welcome again, Kendra, and we're
you.
glad to hear. I'm going to ask you a few questions here in just a moment. But before we do, we'll allow Dr. Mani to introduce yourself. Please tell us about your background as a hematologist and oncologist and what brought you to Adena.
Thank you. I'm Shailaja Mani. I'm a hematologist oncologist at Adena Cancer Center. I've been here a little more than a year. I take care of patients who have blood diseases and cancers of all kinds. I primarily work at the Adena Cancer Center at Washington Courthouse, which is a new cancer center that we recently developed in collaboration with the Fayette County Hospital. But I also work at the main Adena Cancer Center here at Chillicothe too.
What a great addition for the patients in the Washington Courthouse area. Do you provide services at that location that are very similar to the ones here in Chillicothe?
Yes, we do. We have a whole cancer center which provides the same services that we do at the main cancer center. We have a full infusion that is staffed so patients can receive their chemotherapy, blood transfusions, iron infusions, and we also have a fully staffed clinic where we see patients in the office.
What a great partnership between Adena and the hospital in Washington Courthouse. That's fantastic. Well, let's dive right in. Kendra, we're going to start up with you first, if that's all right.
Yeah.
Actually, I'm going to change my mind. I'm going to start with Dr. Mani, if that's okay. Dr. Mani, first, let's talk about prevention, right? What are some ways that we can keep breasts healthy?
I think of like 6 things that come to my mind, and I kind of basket them into first is maintaining a healthy weight and getting exercise at least 4 or more hours a week of exercise kind of ties the weight, maintaining a healthy weight together. The next is our lifestyle choices. Not smoking and no more than 1 drink a day of alcohol, and especially considering red wine over other alcoholic beverages is another. Those help with breast cancer prevention as well. And then finally, keeping up with self-breast exams routinely on a regular basis, and getting your annual mammogram done when you're eligible will also help with early detection and taking care of it at a very early stage when the potential for cure is very high.
So Kendra, Dr. Money just mentioned some of these great tips for us to keep breasts healthy.
Yeah.
And one of those she mentioned about getting early mammograms. So Kendra, for those who are listening out there, when would be a time that people should start getting a mammogram?
Yes, a good age to start for screening mammography would be around the age of 40, and that would be annually and should continue as long as you're in good health. There are those who may be at a higher risk that may need to start a little bit sooner. So it's very important to know what your own personal risk factors are, whether it be your own personal history, your family history. Genetics have a lot to do with it as well. So if you may be at a higher risk, you should meet with your provider to determine your risk, to see if you should do screenings maybe sooner, or sometimes supplemental screenings along with those mammograms.
I think you bring up an important point, Kendra, that not everyone's necessarily the same. So if you want to further understand your risk or perhaps your unique situations, talking to your family physician, obstetrician, gynecologist, or other provider would be helpful in determining when best to start.
Absolutely.
But if I heard you correctly, Kendra, it's around age 40 when women
40.
should start to obtain those annually.
Yes.
All right, thank you.
Yes.
So there's a key point there, age 40. So for viewers who have not had a mammogram, it might feel or seem a little scary or new. Can you kind of talk through what is a mammogram, what will they expect, and how long does it take to have it done?
Yes, mammography is the golden standard for breast cancer detection. We can identify areas in the breast as small as a granule. It's a calcium deposit, as small as a grain of salt. So we can identify those microcalcifications, but also masses. There's just a lot of things a radiologist can see throughout the breast composition that could be a sign of a breast cancer. So to find that as early as possible is their ultimate goal, where it's most treatable.
Awesome. So we can go down to the size of I think you said a grain of
salt.
Grain of salt.
Calcium, very tiny, very small portion of tissue that can be identified. And there are other modalities that can identify breast cancers, but mammography can find it at the earliest.
Okay.
stages.
So now we know that it can be very, it can go down to quite a bit of detail. Can you walk us through what someone would expect as they entered the mammography area?
Yes, Mammography Services here at Adena, we have 5 convenient locations, but we also have our 3D mobile mammography unit to go throughout the community for those who maybe can't leave their work as easily as others may. We offer early morning appointments, late appointments, but a mammogram can easily be completed in 15 minutes. So there's a very quick registration process for our patients. You just attend a registration desk for that quick registration and then go right on back to our mammography department. You'll meet a registered technologist who specializes with mammography. That's all our technologists do is mammography specifically. And they'll be able to complete the test for that. They do a quick history. The images are obtained. Again, the imaging is obtained and completed within that 15-minute period of time.
Is it something that the patient should be scared of?
Not at all. No, it's something that may be uncomfortable for some women, but definitely not painful. We've never had a patient come in and just not be able to complete the exam. I've been here for 15 years, and that has never happened. We do have a certain level of compression that we are trying to obtain as mammographers. Our goal is to stabilize the breast to where there's no motion. We can compress the breast tissue to help alleviate any overlapping structures for our radiologist to view. But that is a very mild amount of compression, and like I said, patients tolerate it very well.
This might be an obvious question, but I'll ask it anyway. Is this done in a private area? Is there a special location for these types of screenings?
Yes, it's always performed in a private room. You're never undressed in front of other women. You have your own, you usually get dressed right inside of your mammography room. So your technologist will bring you into your private room, meet with you, confirm your name, your date of birth, your order if you have one, and that you're due for your screening. They always make sure that you're close to that 12-month time. And then after that, they'll leave the room, let you get dressed privately in your own room, and you're free to go from there. And with COVID-19 currently, we've had some adjustments that we've made throughout our department. So even during the waiting room experience, we have limited outpatient visitors. So it's very safe for patients to come in right now, more so than ever, that it's no concern for any further exposures while they're there.
So Kendra, it sounds like you've taken into consideration the patient's perception and how this would work for her. You've also, if I heard you correctly, you have 5 locations as well as a mobile unit.
Yes. Our mobile mammography unit has been a great addition to our department because we're able to go on site to facilities. Upcoming events include here locally with Kenworth. We go out to USA, Belicio. We have upcoming dates there scheduled with them. But it's helpful for women to not have to take the additional time, and it helps them with the compliance and having that completed when it's more convenient.
Really taking those barriers out of their way.
Yes.
Kendra, can you tell our audience here, we've talked about the screening and the mammography. Are there signs and symptoms of breast cancer that women should be aware of?
Absolutely, yes. So along with your screening mammograms and completing those annually, you also want to be able to know the signs and symptoms of what breast cancer could represent. The most common sign that most patients are aware of is a lump or mass in your breast. That is something that, if you note that, you should absolutely review that with your provider further. Also, signs include thickening. There could be like a dimpling to the skin, kind of like an orange peel appearance. Inversion to the nipple if it ever has a retraction, any discharge, localized pain to a specific area where you feel that there's just a thickening in a specific area. Those are all things that you would want to address with your provider to get the appropriate test scheduled.
Okay. I've heard a lot of lists there, and I think I have some of them down. I think it's worth repeating for our audience. So, as you heard from Kendra, it's a swelling, part of the breast, skin dimpling, nipple retraction, or red, dry, flaky, thickened skin, discharge, and swollen lymph nodes.
Yes, lymph nodes. Yeah. So also you want to check and make sure there's no changes in the axillary region as well.
All right. Thank you. So, if any of you out there are experiencing those symptoms, please make sure that you bring those up to your family physician, again, your obstetrician or gynecologist, nurse practitioner, or other medical provider who can do a further evaluation there. So, Dr. Money, I'm going to ask you a certain question here. How common is breast cancer?
Breast cancer is the most common cancer in women in America, except for skin cancers. Currently, the average risk of an American woman getting breast cancer is about 13%. Which is about 1 in 8 chances to get breast cancer. Now, there is 7 in 8 chance that you won't have breast cancer, but I still think 1 in 8 is a significant number.
Thank you.
Diagnose at least 300,000 patients with breast cancer, newly diagnosed breast cancer every year in America, and 40,000 deaths are attributed to it.
Even more reason then to follow what Kendra just told us about, looking for signs and symptoms and really having that screening mammography done. Of those 13%, are there a particular women or men, right? We'll talk about that in just a minute, that might be at even more risk for breast cancer, that should be more aware of undergoing these screenings?
There is, there are certain risk factors that put you at a high risk for getting breast cancer. It includes having like a close relative or relatives with breast or ovarian cancer in the family, or family history of men having breast cancer, women or family history of BRCA1 and 2 mutations, which are known mutations that increase your risk for inherited breast and ovarian cancer. People of Ashkenazi Jewish heritage, they tend to have a high risk for breast cancer in general.
Okay.
Also, women who take hormone therapy for postmenopausal symptoms, women who have dense breasts, or women who have had radiation to their chest or breast in their early childhood or adulthood for one or the other reason, have a high risk of getting breast cancer.
Thank you for helping us to understand who might want to have more awareness of that. And I think it's critical, particularly for those patients, if you know you have someone in your family with a history of breast cancer, male or female, that would raise awareness. Now, Dr. Money, you mentioned something very interesting that some viewers may not quite understand. So we'll spend just a minute there talking about that, and that's the word, or the use of dense breast, right? Can you explain to our viewers what dense breast means?
So our breast tissue is made up of 3 tissues predominantly. One is the fibrous tissue, one is the glandular tissue, which is the mammary glands that are the milk-producing organ, and then you have the fatty tissue. What dense breast means having more fibrous and glandular tissue over fatty tissue. And if you take like women over 40, at least 50% of them have dense breasts. And the density of breasts kind of varies on certain factors. So we see lower breast density with increasing age for women who have had children and have breastfed, women who use tamoxifen. And on the flip side, we see higher breast density in women who are postmenopausal and are on hormone replacement therapy. The reason why dense breast is a risk factor is because it obscures cancer and it can delay the diagnosis of cancer. So you might be diagnosed at a relatively advanced stage because of just the composition of your breast tissue.
So is it fair to say that dense breast tissue makes it harder to see those grains of sand that you were talking about, Kendra?
Not with the technology that we have here today. 3D mammography helps with that. So that
so tell us more about what this 3D mammography is.
Yes, we brought 3D mammography. It's also called tomosynthesis. In 2018, it was
Say
introduced.
that again for the
Tomosynthesis.
Ooh, that's a tricky one. I think I'll stick with 3D mammography.
3D. It's a way for the radiologist to be able to view and interpret the breast in a 3 dimension. So they're no longer getting a 2-dimensional structure. Mammography, what we would do is complete 2 images of each side. Now the radiologist, even though we're still doing the same procedure, the radiologist with this technology can now see hundreds of images through a 3-dimensional structure. So it scans the breast in 1 millimeter slices and helps us to make sure that we can see the breast in its entirety in that 3D module.
Now, is that a test that's more complicated? Does it take longer for the patient?
Not at all.
Does
For
it hurt more?
No, it is the exact same from a patient's perspective. They cannot tell any difference between a 2D versus a 3D mammogram. They may notice the top of the machine does a little rotation. It does a 15-degree angle for us to obtain that 3 dimension. But from the patient's perspective, it looks just like the same as a mammography unit would for traditionally.
Okay.
Yeah.
Now, I know that in regular mammography, the 2D one that you mentioned, there are some times that women have to go back for something called a callback. They have to go back for re-imaging. Can you just spend a moment in telling us what a callback is?
Yes.
And then does the 3D imaging reduce that callback necessity? Tell us a little bit more about that.
Yes, thank you. It actually does reduce about 20 to 40% with the 3D technology. So with this technology, we're able to, and we do call those, it's a false positive. So anytime that there's something that looks like it may need additional imaging, that something may have changed or may be concerning, the radiologists call those patients back in for additional views. That process in general increases anxiety for our patients because a lot of times those false positives, there's nothing there to be concerned of. It was just overlapping superimposed tissue. Like Dr. Money was describing all the composition in the breast. Sometimes when women have those increased densities, it's harder to see through that. So thankfully, because of those 3D mammograms, our radiologists can see through the breast better than they ever could before.
And with that ability of your radiologist to be able to see through the breast better, are you having better success with diagnosis of early disease?
Absolutely. I'm thinking of 2 patients just this past 2 weeks that the areas of calcium that we were describing were so minimal. We could count 2 to 3 small little calcium deposits. It's remarkable. It's still, we've had it for 2 years, and it still floors me on how detailed the scans are.
And how long has Adina had this 3D capability?
We first brought it in 2018 to our main campus here in Chillicothe. It was not initially approved for insurance companies for all patients. There was a deciding factor of, do you have an increased risk? Do you have high density in your breast? And not all insurances were covering it. So we didn't want to implement the process and worry about patients. Our purpose is to eliminate any barriers, not increase concerns. So we don't want any out-of-pocket cost. So we only did it initially at our main site. It proved immediately to be so successful that we implement it to all of our locations.
And Kendra, is this something that a patient needs to request, or is this something that a provider orders? How does that work between
Here at
determining
Adena,
whether or not you get a 3D mammography?
Yes, I'm here at Adena. We use 3D mammography standard for all of our patients.
Okay.
There are some facilities that you may have to request that. We have found it to be so amazingly remarkable at finding at the earliest stages that we do utilize that as a standard of care. Thankfully, insurance companies now are covering that 100%. There's only a very small percent, I believe the number is maybe 7% of insurance companies that are not covering it. So we have a process in place internally here at Adena to eliminate those charges.
Thank you, and thanks for going into further detail on the 3D mammography.
Yes.
Dr. Money, we know that unfortunately, as you mentioned the statistics just a few minutes ago, more than 250,000, approaching 300,000 individuals will be diagnosed with breast cancer this year. So can you walk through for our viewing audience, what are some of the treatment options now for breast cancer?
The breast cancer treatment is actually multidisciplinary. It involves surgery, radiation therapy, anti-hormone therapy, and sometimes even chemotherapy. And the sequence and what starts first and what comes after and what all the patient gets depends on the stage at which we find the cancer. It's kind of slightly different for each stage, but it does involve more than 2 specialties at the least.
And when a patient comes in and sees you, particularly for the first time, and she has this diagnosis, or he, we've mentioned before that men can get breast cancer, what's some just general things that you tell them?
I think you have to really have a listening heart and be empathetic to them, because cancer diagnosis causes a lot of stress, and breast cancer especially because it is more common, and you're kind of stressed out about whether you're going to go through the same thing your friend or your neighbor went through, and they might have had complications, and you're kind of trying to tie all that to yourself, and it can be very overwhelming and anxiety provoking. So we try to listen to them and try to meet their needs and try to identify barriers when we first meet them, and kind of learn that person so we can not just manage their cancer but help them get through this, because it's a journey. It's a 6 to 9 month long treatment sometimes, and they kind of become your family members, so you're kind of like trying to learn a new neighbor.
And you mentioned it can be very stressful, obviously. So Kendra, talk to us then about what's the role of a breast navigator?
Yes, in my position as the breast health and imaging navigator, I am always in the women's imaging department. So I'm there for screening mammograms. My role is to ensure that there are no barriers for patients to have those screenings. So that may start, my navigation role may start with patients who maybe don't have insurance, maybe underinsured for certain tests, and my goal is to help to get them the resources that they need. So I want to stay educated on top of all resources. A lot of funds are grants, could be just local resources that we may have. So to get them in the door for their screenings, walk them through the imaging process and ensure that they don't have any concerns with finances, transportation, anything at all, just be there for them. And like she said, just walk them through the whole process to get that final diagnosis.
So this is a question for both of you then. Do you work together as the physician and as a navigator? And how do you communicate? How do you work as a team?
Yes, my communication is, we also have patient navigators at the Cancer Center. So my communication is typically directly with them, because we have this handoff process between me and Holly Hooks and Carrie North are their names, and they are medical oncology breast nurse navigators. So they're here, their role is to kind of pick up from the point of diagnosis and do the exact same thing that I'm doing on the imaging end for the cancer diagnosis.
And Dr. Money, from your perspective, is it helpful having a navigator such as Kendra on the team?
Absolutely. Our navigators are kind of the heart and soul of this comprehensive breast cancer program that we have. Kendra does her part with the screening and the diagnosis, and then once they're diagnosed, Holly and Carrie on the cancer center side kind of make sure they're seeing the surgeon, they're seeing the medical oncologist, they're seeing the radiation doctor, just so they understand what all it's going to involve through the treatment. And I think they have done an excellent job to make sure that these patients don't fall through the cracks anywhere, because like I said, it involves multiple specialties and that can be challenging sometimes.
Understood. Thank you. We're joined by two wonderful individuals today to talk about breast health. I want to remind the viewers that if you have questions or comments, to enter them in the box below. And again, we have staff on standby to help us to get those questions. Happen to have one of those questions here, so I'll ask you either one to answer. Do I need to get a referral from my doctor to get a mammogram?
I can answer that question. We have a very seamless process now to where you do not need to get an order. If you are 40 and over and are due for your mammogram, you can simply call 779-7711. That is our scheduling line. And you can just go ahead and schedule your exam. If you have any concerns, any questions, our schedulers are there to assist you with that process. And if you do need any financial assistance, they have my contact information to get me to get you in contact with me to alleviate any other concerns.
Thank you, Kendra. Can you tell us that number one more time?
Yes, that number is 779-7711.
Useful number to have in on hand, right?
Yes.
So let me make sure I understand correctly. You can just call that number. If you meet the criteria, you can schedule your mammogram.
Yes, and those are for asymptomatic patients if you're not having any concerns with your breast and are 40 and over. So if you do have any concerns, if there's anything that's changed that may be new to you, you do need to contact your provider to review that because it's a different type of test. A screening mammogram indicates with no concerns, any symptoms at all. And if you do have any concerns, that is what we call a diagnostic mammogram, and it may need to include a breast ultrasound. So you would need to contact your doctor for that test.
Dr. Manny, we live in a world that's changed, and COVID has touched every aspect of our life. And I'm sure you have not escaped that as well. Can you tell the viewers a little bit about what has changed with COVID-19 and how do you take care of patients differently?
Well, COVID has, set us all up for new standards and new precautions that we all have to take. I think with COVID-19, there was a brief pause with, screening and diagnostic workup, but that was really brief, and we worked very hard to make sure that we had new systems in place and new processes to make sure the safety of our patients come first. At the cancer center itself, it has not impacted the timing of how patients get treated in a timely manner, but we definitely maintain a safe environment with masking and hand hygiene and restricting the number of visitors we can have in the building at one time. And I can confidently say that we haven't delayed any treatments. We've worked very hard to put systems in place so these patients get their treatments just like they would have if COVID did not come.
And would you say there's an advantage for patients? You mentioned you work primarily out of Washington Courthouse with our affiliate hospital in Fayette. Would you say there's advantages to having that delivery of cancer care close to home?
Absolutely. I see a lot of women who don't want to go out of Washington Courthouse. They want to get all their care over there. And to be able to go from screening to diagnosis and treatment locally, I think means a lot for those patients. Not just the physical stress or the psychological stress, but the financial stress of transportation and how much time they have to spend driving down to other areas to get their care versus just being able to do it locally.
Lots of advantages then for being closer to home.
Absolutely.
Talk to us a little bit about once someone has gone through their treatments, the ones that you mentioned variously, and they're doing well. What does follow-up care look like for a breast cancer patient?
So we call that as breast cancer survivorship care, and that primarily focuses on trying to screen and surveillance to make sure that the cancer doesn't reoccur in the breast or in other tissue, helping manage the side effects of treatment, whether it's anti-hormonal therapy or chemotherapy, helping manage stress, anxiety, depression, and psychological effects of the treatment itself, and emotional support. We also provide for screening for other cancers during these visits and about other health problems that can result from the breast cancer treatment. And one I can think of off the top of my head is osteoporosis, which can result from hormone therapy, and we do bone density screening to make sure they do not have osteoporosis, and if they do, we do take care of that too.
We've talked a little bit about post-cancer care. Another question is being posed. When a woman is diagnosed with breast cancer, the other people in her life may not know how they can help. Is there support for the husband or family or significant other that you would suggest that can help her or help them?
Yeah, so I can take that question. So
Okay.
our navigators, Carrie and Holly, not only tend for the patients or care for the patients, they also help offer support for the families. There are several resources available with American Cancer Society that specifically helps the family understand what the patient is going through and how they can offer support. That could be support groups in the form of support groups. That could be in the form of like just having a person to contact, which would be our navigator, to understand better about what they're going through and what's up next. Like, because the question that always is there in their mind is what's next, what to expect after this. Like, is this going to come back? So I think starting with our navigators would be a good point. And in our new patient binders, we also have a whole section as resources for the family that will kind of help give them directions as to where they can kind of read more or get help.
How long does the average patient then have, Kendra, support from a nurse navigator?
As far as from their screening to diagnosis, I'm there throughout that entire process. And as our patient navigators go, I mean, they go completely through their survivorship program. So I know that Holly and Carrie have a close relationship even after diagnosis with those patients, and any follow-up appointments and visits that they have at their departments, they're there to attend and to see them. And like she said, they're like family. So when you get to know patients like they do, they're there throughout the whole process.
They're like family.
Yeah.
How long does a survivorship program how long is a patient eligible for a survivorship program? Or how long does a patient usually stay in such a program?
I don't think there is a time limit to that. We say that if you've gone 5 years from the time of diagnosis and you've had a cancer-free period, we can call it a cure. But survivorship goes on for many more years than that. We see patients that were diagnosed 15, 20 years ago, but still see us once a year for that survivorship care.
Okay. Got a couple questions coming in now, and lots of questions from our viewers. Is there a financial assistance program, and perhaps this is best for you, Kendra, is there a financial assistance program for those who are uninsured and needing to schedule a mammogram?
Yes, the program that I utilize most commonly is through the Breast Cancer Correlation Program. It's a program that will help women who are eligible financially. They have a poverty level of 300% that they do have to do a check-off for that eligibility. But through that program, they do cover screening exams for patients. So that is when patients are not able to cover for their exams or maybe uninsured, that is our number one program that we go to. Because they can help with not only screenings, diagnostics, they would also assist with the biopsy process and then into a diagnosis as well.
You don't want, you're working hard to make sure that folks don't delay a mammography screening because of an inability to pay.
Yes.
Another question that's coming in, Kendra, how long does it take to get the results?
From a biopsy?
Well, no, I think they mean from mammogram.
From a
but why don't you tell us both?
Yes, yeah. From a screening mammogram, when you have it completed, usually results are in within 2 to 3 days. That's assuming your last one was established here with us at Adena. Sometimes it's very important for our radiologists to have the most recent images available for that comparison. No two women's breasts are the same. It's like a fingerprint, just different for each individual. So it's very important for the radiologist to have all prior breast imaging available at the time. So if it's established and readily available, it should only be within 24 to 48 hours.
Okay.
And for a biopsy, just in case that's the question, when a biopsy is completed, we have an affiliation with Ohio State Wexner Medical Center. They're here with us on site here at Adena, and results for those are typically within 3 to 5 days.
Okay. Thank you for that. Dr. Money, we talked about men, right? And let's turn our attention for a little bit to men. Can you talk more about breast cancer in men and what should men be looking for? Is it different for men? And help the male viewers out there to better understand that.
So male breast cancer is basically breast cancer in the, cancer in the breast tissue in men. It's a rare form of breast cancer in men, but when it occurs at a young age, the prognosis is usually very good. The treatment is the same, multidisciplinary, involves surgery, radiation, hormone therapy, and chemotherapy sometimes. The symptoms to look out for are kind of similar to what Kendra mentioned earlier. You could notice a lump or a mass in the breast. You could also notice a change on the skin over the breast, or changes in the nipple area with inversion of the nipple or nipple discharge. The symptoms are kind of similar.
What advice would you give to a man who might be embarrassed about bringing that up if he suspects that he might have something wrong?
I think, if you have an established relationship with your primary care provider, you should definitely bring it up. And I think, just like how you get your prostate exams and, other exams, this should just be part of general exam. I actually have, I can think of a patient who was a male patient who came to my clinic and actually mentioned it and ended up having male breast cancer. He just mentioned that he had, he'd noticed like one of his breast tissue was just enlarged more than the other, and we happened to examine him, and that led to the diagnosis.
So Kendra, let's talk about men just for a moment. You mentioned that women can call 779-7711. Did I remember that correctly?
Yes, you got
okay.
it. Yeah.
But is it fair to assume that men would need to go through a different route for that, or can they call the same number?
If they have their orders, they can call, but since it would be problematic and a diagnostic exam would be indicated, then they would need to follow up with their provider. But
Okay.
once the orders are obtained, still utilizing that same number to schedule.
Okay, thank you for that,
Yeah.
that extra information, Kendra. So can you talk to us the next step? Let's turn our attention here with the minutes that we have remaining about the importance of breast self-exam, right? Can you walk us through what those steps are?
Yes, along with performing your annual screening mammograms, it's also very important to know what your breasts look and feel like. Some women prefer to do their self-breast exam standing up, a lot of times in the shower. Some women prefer to do them lying down. So you just kind of find out what you are most comfortable with to get into that regimen. You can, it's recommended you do check monthly. So as far as knowing what's normal for you, you can do either of those two, but both include using the 3 middle fingers, the pads on your fingers, and using a circular motion. There are 3 pressure points you want to use. There's a light, a medium, and a more firm pressure. But using that in a circular motion or even a linear motion, there's really no right or wrong way to do it. It's just establishing what is normal for you. And there are regions of the breast that include your clavicle, underneath of your arm to ensure you're checking lymph nodes, the bottom of your breast or where your bra line is, and then also into the cleavage area. So as long as you're covering those 4 focal points and everything in between, and really just knowing what is normal for you, and if something does occur to be of any concern to you, taking it to your provider.
And Kendra, can you show us on which fingers to use?
Yeah, there are 3, these 3 fingers, if you kind of collect them together, your brain just recognizes this more commonly than to feel with just one finger to push. So using all 3 fingers flat and the pads of your fingers to do that circular motion is going to be the best way to feel the breast tissue.
Okay, so 3, not 1.
3 and together,
better.
yes.
Okay.
Yep.
And Kendra, how long should this take in a usual self-breast examination?
The time would be different.
Is this 15 seconds? Is this
Yeah.
15 hours? Is it, yeah. Give
I
us an
would think
idea.
an average time would be between 1 to 2 minutes, and it would vary between each patient. 15 seconds would not be enough time to truly do a full breast exam, but it really shouldn't take up much time. A lot of women get into a routine of doing it in the shower. Just because you're already in the bath showering, it's more convenient as long as you're still doing those techniques. Raising your arm as you're checking, those are ways to make sure you're not missing any breast tissue.
And how often should folks do this?
Yeah, once a month is the recommended time to do a self-breast exam.
Okay, so once a month.
Along with mammograms.
With mammogram. And how often again with the mammograms?
Every year.
Every year, starting at age
40.
Right, okay. So kind of to wrap up here, Kendra, last question for you. How is someone, how do you, if they want to schedule one, you mentioned 779-7711. Tell us about the locations and the ease of doing that.
Yeah, it is very convenient for our surrounding counties because we do offer services. We have 2 locations here in Chillicothe. We have here at the main site, which we're operating 5 days a week. Western Avenue here in Chillicothe is also 5 days. We go to Waverly 3 days a week, Jackson 2 days, and then we also go to Greenfield. And that is not even including all of the additional services we offer with our mobile mammography services as well.
Okay. And I want to note that I have a note here that the mobile 3D mammography unit we're actually going to be showing you a list of the dates for the Adena 3D mammography unit. Is the process there the same too for folks who are looking at these dates for the mammography unit? Can they just show up or do they need to call?
We absolutely welcome walk-ins anytime somebody would like to, but that number would be best to give you that time slot so you can minimize your wait time. But calling the number to get your time in would be perfect.
Is this mammography bus easy to recognize?
Yes, yes. It's pink. We definitely
Okay.
had some fun designing it. But yes.
All right, so look for that pink mammography bus
Yes.
that's coming to a date and time in your area. Just as a reminder for our audience, we're asking you to use the hashtag #SupportTheGals in your social media. I want to take this opportunity to thank our two fantastic guests. Dr. Money, any last remarks to folks about breast cancer now that it's October and we're really highlighting that?
I think the one thing is, please go get your mammograms if you're eligible and if you're due for them. Early diagnosis is the single best thing that offers the highest chances for cure with breast cancer, even if you have it. So that mammogram is really key.
And Kendra, any last words from you?
I would just like to repeat that don't delay on getting your mammogram. If it's time you're due for your exam, just call the number to schedule. 1 in 8 women develop breast cancer. So if you are due, call and don't delay. It is the best protection for breast cancer.
Thank you both. And again, the number to call to schedule a mammogram is 779-7711. And then if you need a primary care provider, that number is 779-FIND. And then to find out more information about the wonderful work that Adina is using in the world of oncology, don't hesitate to go to adena.org, where you can find more information about these two wonderful individuals and all of the care that they deliver close to home, whether that's in Washington Courthouse that Dr. Money mentioned today, here in Chillicothe, or in the surrounding regions that Kendra mentioned. I do want to remind you as well that we'll be back here again in 2 weeks on October 22nd. We'll be discussing how to prevent, reduce, and treat hypertension, otherwise commonly known as high blood pressure. Thank you so much again for this time that you spent with us in this October month where we're bringing really the attention to breast health. And again, the last parting words from these two individuals: get your mammograms done. Thank you so much for your day.
Thank you.